Always find out the root source of the problem first before try to do any type of therapy. Because a lot of times is when you go through certain therapies, the person that is treating you might not be trying to figure out the problem for you. They're just treating the symptoms of the discomfort. For example, like you end up having a shoulder pain, and then you go see someone for the shoulder pain, and they're going to help you by massaging the shoulder, or they'll put a TENS machine pad on there to help you with the pain of the shoulder. But it doesn't mean that that's the source of the problem. Like, they're just treating the symptoms of what you're having. So when they're doing that, does that help with the pain relief? It does. It does help with the pain relief, but not specifically to get rid of the problem, because that pain is always going to be there. So by treating it, they're decreasing the pain for maybe a day or two, perhaps a week, and then the pain keeps coming back. So this is what a lot of people keep telling us, is the pain keeps coming back. I went to see who, did certain therapy. It was great for a week or two, or a day or two maximum, and then the pain just keeps coming back because the root source of the problem wasn't found. They weren't treating the actual location of where the pain was originated from. So without doing that, that's why the pain keeps coming back. So when that keeps happening, that becomes a chronic pain. So the pain doesn't go away, it just keeps going into that cycle of chronic pain. The more you accept the pain the way that it is, the more it's not going to go away. The more that the tension is going to be there. So even when you rub it, you put like an ointment or a cream or something like that, it's still going to be there. It's not going away. The more you accept it, your nervous system will understand that, okay, this is where it is, this is where I'm having the pain, and I'm going to accept that the pain is there. So when you do that, it's no different from you typing on a keyboard. You type a certain way and you keep hitting a certain way. So you know that this is my natural way of hitting it. So it becomes second nature.
So since nandito na rin kami, naisip ko na i-consult na rin yung parang totoong pain na nararamdaman ko. Kasi meron akong mga tendonitis sa mga wrist from playing a lot of basketball back in the day and a lot of working out. So yun, itatry natin.
So you mentioned the elbow pain that you're also having. So this is the source that you're feeling from in here. Is that right? This one? And also here on the wrist joint, right? So on the bottom there. So there are a few areas that this thing is actually causing the pain. And I'll show them to you right now. If it is, then you'll have pain there. That would be the first one. How's the pain here? Hurts a little bit, and this is the second one. How's this one?
This one is alright.
There's another one that's underneath that is connected to there. How's this?
That hurts.
So 3 spots that's actually affecting you. So what I'm going to do is I'm going to work on this a little bit, and then we're going to have you to redo the same test again. And you can tell me if the pain changed. Now this is without me working on the hand at all. So I'm not going to touch that hand or the wrist area, nor I'm not going to work on the elbow area. I'm just going to specifically work on this, because this is the source of the problem. So there's 3 areas that I need to loosening up the muscle first. And like I said, you will feel that pain there. If there is a problem, you're going to feel that pain. So how's the pain right now? Is it tolerable?
No, it actually
It hurts, right? Yeah. So that's the source. So manually, we can work on this by using hands. We can also work on the shoulder bone to help decrease the pain. But more importantly, if these 2 areas are too painful with manual manipulations, then we can use other machines to help assist with that. So we could use our latest technology. What we have is called a super inductive system. So we can use that, which pulses a very high electromagnetic field to help regenerate the muscle tissue. So we could use that to help that heal. Or we can also do manual manipulation directly to help loosen up the tissue. So I'm just going to loosen this a bit more, and then we'll have you to retest after. if you look at where is the root source, so you have to take a look at the whole health history. So for example, if someone has the shoulder pain, then we have to look at what is their lifestyle. What are they doing daily basis? Are they sitting on a chair, on a computer constantly every single day? Are they doing a lot of repetitive motion, like they work in a factory, or they work as in trade, so they're electricians or plumbers, which is using a lot of the drills, cutting, seesawing, so doing a lot of those motions, but they're constantly holding their joint into one specific position. So when you're constantly holding into one specific position, your brain knows that hey, this is what I'm doing, and this is the motion that I need to do. So in order for me to do this motion, I have to tighten up certain muscle groups to protect this joint, so then I can actually do this effectively. Because if it doesn't, then there's going to be more wear and tear. There's going to be more wear and tear in the joint, wear and tear on the muscles, overuse certain groups. So the brain knows that something is wrong, and it needs to do that in order to protect it. That's why this becomes second nature. As you keep doing it, this becomes very smooth. It becomes second nature because the brain knows that this is the proper position of whatever you need to do. But of course, we know that this isn't the proper position, that we need to do this on a daily basis, but you change that mechanics by doing this constantly. So the brain have adapted to whatever this is, and they tense up the certain muscle group. So then if you say, looking at the root source of the problem, so does it mean, oh, I got to quit my job now because my job is the source of the problem? No, the source of the problem is you have to look at, here's the pain, what's connected to that is causing the problem? Is it the other muscles that's overwork? That's why this muscle is not working. That's why this muscle is not causing the pain. So you have to look at that whole picture, not just that one area is pain, then that means that injury is there. Usually it's not like that. Usually that piece of muscle is having a problem because the other areas is actually causing that in the first place. So then you have to look at, is it because of this? Is it because of this is causing that? That's why this is overworked. That's why this is having a problem now. Or it's not because of this, but something else down here is making this not working efficiently. That's why that is having a problem. So you kind of have to look at that one area of the pain, what's surrounding the entire area to lead up to where is the root source of the problem. That's one thing. That usually what happens with chronic pain is because of that. Now, however, if you say, I bump into something, like I hit my arm into the wall or hit my arm to a desk or something like that, then you have a bruise, then you have bleeding, et cetera, then that, of course, is the root source of the problem because you bump into something. But then this should be healed within a couple of weeks. No, probably 2-3 weeks, 4 weeks, something like that. Tissue starts regenerating, then the bruises should be gone by now, and the joint should be fine. But if the joint is still having a problem, so that could be a reasoning of something else is not making it to heal properly. So that could be the muscles from the back. That could be the lymphatics, the lymph not draining properly, affecting that blockage, which is also affecting the circulatory. So that goes into a different way of looking at, just because I bump into this must be the reasoning of the root source of the problem. It doesn't mean that that's the root source of not helping it to heal. So that's another way of looking at the root source. Normally, the chiropractor would like to do a lot of the high velocity adjustment, which is like pushing down very hard, really quick to make that correction in the spine. Whereas for us, we can just do very gentle motion into the spine to help release anything that is causing the stiffness. But we don't need to really force the direct manipulation. If the other area is causing the adjacent issue, then we have to look at how we're going to treat it. So how we're going to treat it depends on the location. What really is the cause of that? That determines what type of treatment. So treatment can be like you could do manual manipulation, which is kind of like, we don't call it massage, but most people call it massage. We just call it therapeutic soft tissue. So you could do that, or therapeutic massage, if that's another way of saying it. You could do that. You can stretch the tissue. You can work on the fascia. Fascia is basically the connective tissue wrapping around the skin layer to the muscle tissue, but there's other different fascial layers, of course, but we're not going to dive deep into that because that's like a whole semester of the talking about fascia. But avoid doing that for now. Just talk about the most basic things, right? So if you have inflammation, like you bump into something, inflammation happens, swelling tends to happen. At that point, you don't really want to massage that area as much as often, because that's going to stimulate more of that inflammatory response. Now, the old way of thinking would be using ice. Now, this is a debate, because a lot of people tell you the first thing when you bump into something, it's best to elevate, it's the best thing to ice, because that's going to help decrease the inflammation. However, the newer case studies now show that you shouldn't really ice it now. You should be heating it more to speed up the regeneration. So if you heat or ice, they both kind of work synergistically together. So now what's happening is we're going to have people to do ice for 10 minutes and then heat for 10 minutes to speed up that regeneration. How ice works is ice will shrink the tissue, decreasing the swelling. And then what the heat's going to do, the heat's going to pump it back up to bring more blood to the area. So you're acting like a pump. So ice is going to squeeze, heat's going to bring it back up. So by doing both, speeds up the regeneration that way. So that's one thing can be done if someone bumps into something on their elbow, or they slip and fall and strain the muscle. They can do either or. They can also take medicine over counter like Ribacicet to help with the muscle spasms. But generally, if you're not inclined to taking medicine, then the ice and heat protocol will be generally more better for someone. Any pain on the bottom there when you're doing that? Because that's when the first experience when you were doing this.
No.
Okay, good. But we'll still need to follow up on working on those muscles, because that is the source of the problem. Because you're doing a lot of the layups like this and you're shooting the hoops a lot of like this. So all the repetitive motion goes into the tendon, into the back, to that back muscle there. Even though you're feeling pain here, there is a problem here, but the back is what's stopping this to heal properly. So we have to treat the back, and that will help this to heal better. And then we can treat this specifically. But if you go to a physio or somewhere else, or physios will love to tend to work on this first before they work on that, because that's the source of where you're feeling the pain and discomfort. Because this is what we call symptomatic treatment. So focus on the symptoms of the discomfort and then treat based on the symptoms. Whereas we, for osteos, love to treat the opposite of that. We like to treat the source of it. We treat the source, then help with the symptoms. Doesn't mean we're not going to treat the symptoms, we are, but the source has to be fixed before we treat back. That's the difference. Treating formats are, again, is very, very different depending on the individual, because like I said, it all depends on their lifestyle, what they do for work, their sitting position, posture, previous traumas from injury, from playing basketball, volleyball, badminton, or the swimmer. So all those determines what type of mechanics that their whole body is suffering from leading up to the injury. So for example, like if you have a frozen shoulder, if you have a shoulder pain and I have a shoulder pain, our lifestyle is completely different. So I can't use the same formula of treatment on me that will work for you, because my lifestyle is always constantly moving. I'm always using my arm. That's leading up to my shoulder injury, for example. Whereas you're sitting in the office all the time, typing on the keyboard, tightening up the joint leading up to the muscular problem. So I can't use the same method for you versus me. For you, I have to loosen up the joint, work on the muscle to make it softer in order for you to bring the shoulder asymmetry back, like more evenness on the both shoulder. Whereas for me, because I overuse, I can't mobilize my joint because it won't work for me. So I have to do strengthening muscles in order for that to repair more better. So different pain, different type of treatment, depends on the different person's lifestyle.